everyone. I'm Rich Lucy, Senior Prevention Program Manager here at the Drug Enforcement Administration's Community Outreach and Prevention Support Section. Welcome to this episode of Prevention Profiles Take 5. I'm very excited about today's guest. It's going to be a little bit of an old homecoming, if you will, between the two of us. It's Dr. Dessa Bergen-Cico, and she's at Syracuse University. Let me tell you a little bit about Dessa, and we'll get into our interview. So, Dr. Dessa Bergen-Cico is a professor in the Department of Public Health, a core faculty in the Renee Crown Honors Program, a faculty member in Interdisciplinary Neuroscience Program, and coordinator of the Addiction Studies programs at Syracuse University. That's 4 hats right there that I've picked up on, Dessa. She's worked in substance use prevention and treatment for over 30 years. Prior to becoming a professor, she served as director of substance misuse prevention at Syracuse University for 10 years. Dessa has received 2 Fulbright Scholar Awards, which embedded her in the Republic of Georgia, Thailand, and Cambodia. For over 15 years, she has worked in collaboration with the Council of Europe to provide education and trainings in drug policy and the impact of conflicts and geopolitics on substance use across Europe. Her areas of teaching and research focus on addictive behaviors and geopolitics of drug policy, in addition to evidence-based interventions for substance use disorders and PTSD. She has authored more than 50 scholarly publications, including the book, War and Drugs, The Role of Military Conflict in the Development of Substance Abuse. Dessa, welcome to the podcast.
Thank you, Rich. I'm delighted to be here and to reconnect with you.
Absolutely. I said it's a bit of a homecoming. I'll get into that in my first question, but before we get into the interview, why don't you start with just telling us a little bit about Syracuse University? It's a high-profile school, but tell us a little bit about the campus.
Yeah, so it's an urban-based campus in a moderate-sized city in central New York, and we are a Division I athletics program. So sports and athletics is a big draw for the community as well as for the students. We're home to some pretty leading academic programs in the Maxwell School of Citizenship, in our sports programs, public health, engineering, among many others. And we have a relatively large undergraduate student population of about 15,000 students, 15 to 16,000, and graduate programs as well. So Research One University with doctoral programs and master programs.
And if I remember correctly, because people know I started my career in New York, it takes up, I mean, it's a big size chunk of Syracuse, right? I mean, it's urban, as you said, it's in the city.
Yeah, it does. And one of the things that is luckily for us, fortunately, we've had a string of several chancellors who have seen it as being primary to the mission to be embedded and integrated in the community as well. And so not only are we physically located there, but we are also heavily linked to the community. So when we talk about prevention and we look at things afterwards, it's not only what's happening on the campus, it's the impact in the community, and then also working with the community as well around prevention and harm reduction initiatives. So yes, it's very symbiotic.
Excellent. Takes us back to the town-gown relations, hopefully not the finger pointing that often happens between campuses and communities. It's nice to have, especially the leadership from the top, looking to make that connection between the campus and the community.
Yeah, those are some terms I haven't heard in quite a while. So we talk about town-gown relationships, and I think in the 80s and maybe early 90s, those were challenging components when we looked at that on a national scale. And universities realized they needed to quite readily do some things to correct it so that they weren't seen as imposing maybe visitors, but really anchor institutions.
Yeah. All right, well, let's just jump into the interview. We'll hop into the Wayback Machine here, if you will. So you and I have known each other going back to the 1990s. Boy, that seems like a long time ago. When I started my career leading New York State's efforts for the state agency there, government agency, to prevent alcohol and drug misuse among college students. So we know a lot's happened over those 3 decades plus. So from your perspective, how has prevention in the higher education space evolved since then?
Yeah, I would say that it's evolved in terms of really kind of in being able to embrace the results and the science around things. So it used to be very difficult to address issues head on. So, for example, in the 90s, I remember we had some challenges with residents' life where the prevention program and office wanted to have in everybody's residence hall information about warning signs for alcohol poisoning, how to assess for that, where to call for assistance, those types of things. And the concern from administration in the residence halls was that, well, they're 90% of our residential students are underage. They shouldn't be drinking anyways. So putting that information there is seen as giving a nod to or permission to that. We've changed tremendously from that now. So, for example, just at our institution, and I've seen this trend nationwide as well, um, people have moved towards what we call sort of Good Samaritan policies, where if you call for medical assistance for a student who has had too much to drink or has perhaps used some other substances, the aim and the mission of those policies is to make sure that somebody doesn't get sick or die. And so there's, rather than being punitive, if you call, the aim is to help individuals. And also going from where it used to be, if we talk about these things, it's going to give people permission or seem to give that the institution is giving permission or recognizing that students are engaged in maybe illegal or illicit activities. We now have full-scale harm reduction training. So in the use of naloxone and overdose prevention, overdose reversal, which may, again, that could apply to anyone that you might encounter in the community as well as students on campus. But those are some of the things that stand out to me as a real shift in what's happened in higher education. And I think it's also reflects a shift of what we've seen as a society.
There's two things that stand out for me in what you brought up. One is the embracing of the science. So, when I've done presentations where I've had to do like a retrospective of the last 30 years, and when I started my career, it was 1991. That was really the very beginnings of the science starting to take hold, with the Institute of Medicine and the prevention researchers looking at this. And so science really has evolved. We have 3 decades plus of research telling us basically what works, what doesn't work. We know that the crashed car, the one-off assemblies, we know they don't, have any long-lasting effects. But you mentioned harm reduction, and it's funny because the term itself has been around since I entered this field, but from the federal government perspective, as it was embraced and brought about with this current administration, that was a seismic, this is my term, it's a seismic shift for the government to be talking about harm reduction and having grants and being able to purchase, Narcan and fentanyl test strips and such.
Yeah.
We talked a little bit about this or mentioned it by email. I've always said I've walked the tightrope, if you will, around harm reduction in the college space because of what you mentioned. It really started with alcohol and the minimum legal drinking age. Absolutely, our first prevention message should be non-use for those who are not of age. That is our first message. Then comes the but. For those students who choose to ignore the law, then what is a school to do? And that's where those harm reduction, risk reduction strategies came into play. And that's where you and I first met, was, like I said, in this space of that time 30 plus years ago.
Yeah. Yes, absolutely. And we may have even had some contact prior to that when I worked for state education and Oasis in the public school sector, where it was even more so limiting.
Absolutely.
In
Yeah. I
terms
mean,
of
you didn't have those conversations
right.
in the K-12, obviously elementary and secondary up to seniors. But when you're dealing with that mixed age population, that's, where a lot of this come from. But now even harm reduction has become so much broader in terms of a philosophy, I guess,
Mhm.
and I think Narcan drove a lot of that with naloxone, Narcan being available on campus to reduce overdose effects.
Right, absolutely. And to, step it back a little further too, in some public schools. So the recognition of loss of life and the pervasiveness in terms of overdoses has really necessitated looking at life-saving efforts and skipping over some of the concerns, I guess, or the things that really seem to tie our hands around enforcing, as you said, enforcing the law and adhering to what your responsibilities are as an administrator or official representing, public agency in any way or capacity, and then looking also at what does the evidence show that works, and then what is the humanistic, ethical responsibility that we have for folks.
Yeah. You also mentioned, before I go to the next question, you mentioned Good Samaritan policies, which, I think even those policies have also been met with resistance at times. I don't know if it was the case at Syracuse. You don't have to speak to it specifically there, but in your experience, do you feel there's sometimes pushback on those types of policies because people feel that there shouldn't be carte blanche, absolutely no repercussions? Basically that's what these policies are saying. You're not going to get in trouble if you're helping somebody.
Right. I mean, I've seen the dialogue and the discussion, not only at our in the United States, but also in some other areas around looking at, what is the I would say perspective in terms here of what message are we sending, and sometimes people are very conflicted around the difference between those aspects, and if somebody is doing something that we deem to be illegal or that is socially unacceptable, how do we comport that with providing information, which seems to some people believe that education is going to encourage behavior.
Right.
So it is a challenge, and depending again on the society, depending on sort of the tenor of the community or the institution, those things take on different voices. But I'm happy to say that I see that it's really become much more of a normative perspective around those components, and that trying to move away from a punitive response for you are in the presence of people who are using or had come upon someone, looking at, okay, let's take this as an opportunity to provide risk reduction education and see what else is going on here as with this individual or with this group of individuals, and to establish a safety net for people.
Yeah. So I will now move on to my next question, and it really looks at now this issue from a public health perspective. I mentioned in your bio that you are a professor in the Department of Public Health. So what are your thoughts on how preventing alcohol and drug misuse among college students can transcend from being seen as solely a student affairs issue, which we know is often the case? That's usually where it's anchored, these efforts, to a broader public health issue?
Yeah, and I'll speak from experience, having lived on both sides of those sort of hemispheres of the institution of higher education. I started in student affairs, and at the time we really had a lot of interesting engagement and support with faculty. So we saw it as a way to sort of bridge issues that were going on in students' lives with academic content. And so when the opportunity to present itself for me to join the public health faculty and work on these issues in depth and over the course of perhaps a semester, if not longer, with students, I jumped on it. I can say that though, after having joined the faculty, you are pretty, it's easy to be unfamiliar with what is happening in student life. So if I didn't have that experience and know about those resources, I would be in my narrow lane, as many of us are, and be completely unaware of how these things are linked to student lives and what's going on in the lives of students from that perspective. Addressing it in an academic perspective, perhaps more so from a sort of developmental or student life perspective, does give you the opportunity to look at it in a sort of neutral position to deepen engagement around it, to really analyze the root causes, or to look at it from many different perspectives, and almost any discipline. And so there is a great opportunity here. It's a topic that is fascinating to students. We developed an addiction studies minor, and one of the core courses in that class or in that program enrolls 200 plus students per year. We used to have 200 plus students per semester, and we tried that became a little unmanageable. But the appetite is out there for people to learn about and study these issues. And so I would say, for faculty perspective, you can address it from an academic analytical perspective that gives students the opportunity, when done right, to wrestle with what is this, what role does this play in my life, or what role does this play in society, and how might we more effectively address it from either demand perspective, harm reduction perspective, treatment perspective, policy perspective. It applies to neuroscience. It applies to engineering. It can apply to any mathematics, psychology, marketing, lots of different ways to integrate it. And the students are just very hungry for working on this topic and find it really engaging.
Something you said I want to ask you about, which I think is going to then segue into my next question. You said, as a faculty member, and maybe I'm paraphrasing this incorrectly, so please correct me if I'm wrong. As a faculty member, you won't necessarily see the broader aspects of student life. Is that more or less? And then, but I was thinking, it's interesting. We think of the different stakeholders on campus who have that face time with students, and certainly faculty members are right up there. And so I guess that's a little counterintuitive to me initially, is that you are interacting with students on a regular basis, but do you think it's because, I think your word was kind of that narrow lane, is it more or less because you're focused on what it is you're teaching in your class? You're not really necessarily, and I'm not saying this is good, better, indifferent, or pejorative, it's just you're not necessarily seeing the whole of the student experience. It's more or less the student you're seeing in front of you in your class.
Right. And the really kind of split components of, we think of faculty as being primarily focused on teaching and perhaps research, but teaching, the way it's constructed at most institutions, teaching is like 40% of your responsibility, research is 40% of your responsibility, and then advising, administration, assessment, et cetera, grant writing, everything else is supposed to be another 20%, but it really ends up being, 40, 40, 40, which is more than that. So it's like you're drinking out of a fire hose, and the ability, the time, the opportunity to engage with students outside of that time you have with them in class becomes increasingly narrow, or can become increasingly narrow. And so unless a student's struggling or comes to you, to talk about a personal issue or a challenge, or comes to your office hours, as they might, if the topic of the course is relevant to something that is going on with them, you don't often recognize that there's something going on until they stop coming to class, till their grades start to drop, those types of things. Now, having said that, fortunately, there's a lot of new early warning systems that are in place in terms of mid-semester progress reports. Even earlier than that, we have early semester flags and those types of things that can identify if something, maybe is awry with students. But there really isn't that opportunity. And, we're trying to find ways institutionally to bridge that student affairs, academic affairs perspective, and to be able to have recognize the important role that both can play in really the development of the student and the student experience as a whole. And it's a challenge because it's becoming much more of a business operation enterprise than a pursuit of education in some regards.
So we did tee it up for this next question, and you actually sort of use the word challenge right there. So as a faculty member, what are some of the challenges that you face when it comes to drug misuse among college students, and what are some of the ways that you try to address those challenges?
Yeah, and as I said, it'll sometimes come to your attention when a student is struggling in class, because of the nature of the topics that I teach. So I teach all the courses, or my courses are all related to addictions. Uh, that often students will stay after class or contact me for office hours or disclose in writings, some of the things that are going on with them, their family, their peers. And so there's a natural bridge and an opportunity there to talk about those things. But as I said, I think most faculty members are unaware, and it's not out of willful ignorance. It's just, as I said, described before, the complexity of what is expected from your position, and grant acquisition, et cetera, that is beyond, so much further beyond what we're really think of as the primary mission, which is engaging with the students and helping mentor them beyond the classroom. And so you have to have an idea of what resources are available to students, and to also see it as part of your mission. So I think, I'm identifying the challenges. I think some of the solutions are real clear messaging from administration that both elements of the institution are valued. So if you're looking at student affairs as well as academic affairs, and an expectation that there is a benefit in terms of how you're valued as a professional by engaging with those components of student life as well.
I'm glad you mentioned that. I was going to ask you my kind of bonus question here that I just was thinking of was kind of what advice do you have for faculty members who, let me back up. You mentioned that, being in an addiction studies program, the students that you interact with on a regular basis, we know that hardly anybody is untouched by, addiction somehow. I mean,
Mhm.
that either in their family or they know, friends and their families and such. And that, within an addiction studies program, you come across that, as you said, in writings after class, maybe during class, what have you. So for the poli-sci teacher, the marketing teacher, the theater, theater major here, the theater professors, not necessarily in the sphere of the addiction studies program, kind of what's your primary takeaway or guidance for them, on what to look for or be aware of?
Yeah, so I guess there's a couple of things. So one is like looking, certainly, I guess maybe going back to the type of preparation we used to do for public school teachers. In New York State, there has been a requirement for a minimal of like a 1 credit course training in terms of drug education, and what are the warning signs and what to look for. So that, coupled with mental health issues for faculty in terms of warning signs, referral processes, would be a bare minimum. But I'm also, you're helping to remind me of what was sort of, I guess, in vogue in the late 90s, early 2000, was the idea of curriculum infusion. So
Yeah.
partnering with, if you're thinking of the theater program, looking at having either trying to study the accuracy of how do you portray somebody with addiction, theatrically or in film, however that is, wrestling with the difficult and complex issues of how it impacts families and societies. Those are ways that it's a fantastic exercise in terms of difficulty and range of emotion if you were trying to cultivate acting skills or thematic writing skills, but then also to look at all that is needed for where the students are going to be immersed in studying that topic and deeply reflecting on it themselves. That would be one example. In marketing perspective, I know when we had, actually with New York State, we had a social norms marketing grant in the early 2000s. And when we tried to do it on our own as student affairs professionals, it fell a little flat. When we engaged the students from our Newhouse School of Communications and from the Student Marketing Club, it became, much more vibrant and responsive, and the students, paid attention to it. So there's a lot of ways that we can link those components between what's going on in student life, and not only college student life, but it's a mirror and reflection of what's going on socially, and then addressing those in deep and thoughtful and creative ways academically. And it's just so rewarding on both sides. Those are just a couple of examples. Poli-sci. So I actually have the drug policy program that we've been running for almost 14 years with the Council of Europe, looking at how, I would say policy is a little bit like economics. We think that it is this staid and isolated topic here, but it really is so interdisciplinary and reflective of everything that's going on in terms of world affairs, social affairs, and how those affect people's mental health and well-being, as well as substance use. And they're so connected. When you start to look at solutions, it might seem simple at first, or something might seem logical, and then you have to back up and look at the complexities. And again, those offer profound opportunities for students to deeply look at and understand these perspectives, and also to reflect on whether it's their own use or what's going on with friends or family members or society, to find ways to really be effective in addressing demand reduction, recovery, harm reduction.
It's you mentioned curriculum infusion, and again, takes us back, right? With the phrase. And I go back to a mutual friend of ours, Catherine Wessner Hartz, down now in North Carolina, Wilmington. When we were all in this together, and still talk about this, it was a great way for faculty members to get involved in this subject matter, because you could pretty much infuse alcohol and drug education in almost any type of major. I mean, you mentioned just three, right? With, theater and poli-sci and, policy. And you also mentioned resources. I think that for faculty members, we're not expecting you to become the expert on this topic, but simply knowing where you can point a student to, both on campus and even off campus. There is stigma that still is out there. Students maybe don't want to go on campus. Maybe they want to look off campus for help. So, knowing the resources, I think, is probably one of the best foundations that a faculty member could have.
Yeah, I think you're absolutely right. And there seems to be a pretty good recognition from faculty that they are maybe feel, I don't know, overwhelmed, underprepared, or at a loss for how to deal with the flood of mental health issues that are presenting in the classroom, and recognizing that mental health and substance use are really not different, not too different, and often co-occurring factors, and have a lot of the same, risk factors and things that can exacerbate them. And so we've been moving towards trying to make better efforts to educate faculty for how to identify and refer students in that capacity, particularly in the past few years, where it just seems to have become a leading issue. And recognizing also that if you can work on that topic, you can also work on substance use as well. So mental health and substance use have, as we recognize, have a lot of overlap.
So I'll stick with the theme of faculty members and assignments, because my next question, when we reconnected earlier this year, you told me that you had assigned DEA's website, campusdrugprevention.gov, and this podcast series to students in your Master's in Public Health Prevention Science course last year. So first of all, thank you, and what a great way to use our resources. That just thrilled me when I heard that. But tell us how that came about, and what the assignment was, what some of the students' reactions or outcomes were.
Yeah, thank you. And so I was wondering, this is how I found where you had landed again. So I was searching on podcasts for the topic of looking at drug prevention, because when I go running every day, I like to educate myself so I can multitask. And I was looking for some more recent information out there. And so I came across the podcast, and I was teaching the prevention science course, and I'm always looking for some new ways to get the students to engage beyond reading academic articles and traditional assignments. And I had a handful of students that they had a prevention science project that they needed to work on, and they chose college students looking at alcohol, tobacco, cocaine. Those were, I think, the three main substances that we had different groups working on. And I said, okay, here's the assignment or whatever. You want you to go in, listen to these podcasts, review these resources, and look at how that might inform what you were proposing as your intervention strategy. Because even after all these decades of, we know that the Just Say No campaigns don't work. I can't tell you how many times students still sort of regurgitate those things. And I say, what is the theoretical basis for behavior change here that you have? You've missed the assignment. So it was, again, putting people like, go back into some of the more contemporary resources, listen to what the experts are saying, reflect on these strategies. And so that the podcast and the resources on the website were a great way to kickstart that.
That's great to hear. And unbeknownst to me, I didn't know you were going to say this, but you talk about listening to the podcast when you're out running and multitasking, and I've said that on more than one occasion, both on the podcast and in workshops that I've done. And I'll call to mind another name from our past, Fran Harding. She's always, wherever she was, she always told the staff to continue to hone your craft. And, I have said that, you have to, for people that say, well, I don't have the time, a little bit of tough love comes out and says, well, you have to find the time. Yeah. And even if it's a half an hour, set a meeting with yourself, on the calendar, that you're going to read a journal article, listen to a podcast, watch a news program, read a publication. You do that once a week all year. If it's half an hour, there's 26 hours of professional development right there. But you were an example of just bringing that up, that's kind of how you do it when you're doing other things.
Absolutely. And along the lines of that, in terms of education, information, and resources, I would say, one of the good things that came out of the post-COVID component is that there are such fantastic access to professional development webinars, which you can listen to if you don't have if they're not in podcast version as well. And ISIP has a nonstop stream of, like, every couple of weeks, they just have a fantastic global topic related to looking at, really gearing it towards, when we look at in higher education, their primary audience are faculty who are teaching courses linked to and related to substance use, or preparing substance use prevention professionals. And again, it's such a broad range of that. So that's one great example. And then we have the in the US, I'm most familiar with the New England or Northeast and Caribbean Technical Assistance Center. But again, those programs, fantastic professional training, easily accessible. You can sign up for them. And if you can't attend, they usually send you a link to listen to the recording afterwards. So yeah, no excuses, I guess.
Yeah, right. There you go. No, no excuses. Well, as we wind up, first of all, I've so appreciated getting this opportunity to reconnect with you and talk about these issues. I always end the podcast interview with this particular question for our guests, and that's, what's the takeaway? What's the one piece of advice or more that you have for our listeners, which includes students, as we know from your assignments? What's your advice who want to make a difference in preventing drug use and misuse among college students?
If I was to put it into like a short statement, I would say follow the science. And so there can be a tension between, what perhaps we ideally want for people, and then also what they respond to. And the addictive behaviors can be seemingly sort of defy logic. Sometimes when we look at how it's impacting individuals, But when you look at the science behind what is the origin for substance use seeking behavior and how it interacts with people neurophysiologically, psychologically, uh, 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 and socially, it requires a reassessment of how we approach prevention and how we really look at this as not an issue of morality, which is, I think, the box that it was in for a long period of time, and
Long
bringing
time.
it back to the science. And that can be tough for any of us because it can, really force you to have to change and abandon your historical approach. It can be conflictual with maybe your own values. Um, but it is necessary to keep focusing on the science. And I don't just mean the medical science, but also looking at the social sciences of what is effective, what do people respond to? And the effective prevention, particularly around college students, requires that partnership between academic affairs and student affairs. And as you noted before, continuing education and continuing to hone your craft is essential. And this is such a fast-moving subject area that it necessitates staying on top of it. So knowing that it's okay to say, I don't know about that. There's so many different areas, and feeling comfortable with reaching out to resources either on campus or in the community, wherever they may be, in order to fill those knowledge gaps or partner with people who are or more knowledgeable in certain areas than one might be. And engaging students in the study of the subject matter is also essential because I continuously learn, particularly in the addictive behaviors area, when we look beyond just substance use, but the addictive behaviors area, new insights and new perspectives and emerging patterns and behaviors from listening to the students and what they're experiencing, what they're observing, what's going on with people around them. So it's never a dull moment. And sometimes it feels like a problem that, may not ultimately be solved, but as we said before, things can be improved. There can be some reducing harms is a primary aim and objective with prevention, certainly. And yeah, following the science, I think, goes back to the key.
It's a perfect advice and takeaways there. And yeah, follow the science is a hallmark there. And you said it toward the end there. I've always said, when I describe the work that I do in preventing drug use among primarily youth and young adults, primarily in that young adult space, college students, I've always said it's an extremely challenging job, but it's also extremely rewarding. There are some great highs, there's some horrible lows, as we know, in this work. But we keep moving on, and the science does guide us in the direction in which we should go. So I'm glad that you brought that up.
Yeah. I would say also for people who need or who want to have any longevity in the field, I know certainly you found this as well, but compassion as well as self-compassion are really important, and self-care for those people who are working in the field. So you need to remain compassionate and open and curious about what's happening. And then knowing that in your heart, you're putting your best foot forward and trying to do the right thing for the right reason. And it may not always work, but if the intention is right, sometimes it's the best we can ask for in a given moment.
Absolutely. That's a great way to end the interview, which that's just a perfect sentiment. I really do appreciate it. Dessa, I've really enjoyed having you on this episode. I feel like we've kind of just picked right up
Yeah.
a little bit where we left off. We've got so much in common with our roots in New York and the work that we're both doing. It's just been fabulous to have you on here, and I know we'll continue to stay connected.
Thank you so much. It's a wonderful bookending of where we kind of started and where we are in our further along in our career, shall we say.
Absolutely. So to our viewers, I want to thank you for tuning in to this episode of Prevention Profiles Take 5. And of course, you can watch all of the previous episodes on campusdrugprevention.gov. And with that, I'm going to say thank you for watching and have a great day.